approximately 40–41% of dementia could be attributed to 12 risk factors that are preventable. So I divided the 12 up by category. So from the medical condition angle, high blood pressure and obesity are the two most important factors. Diabetes is next, depression, and then traumatic brain injury. From the lifestyle and habits category, physical inactivity is the most powerful one, but also smoking, excessive alcohol use, which is defined as more than 14 drinks a week, social isolation, and educational achievement, which is defined as less than 12 years of education. And then just to go back to the physical inactivity, that's you're considered physically inactive if you have less than 150 minutes a week of moderate, at least moderate intensity activity. So that would be half-hour a day, 5 days a week, doing something that gets your heart rate up to the point where you should still be able to talk, but you can't sing while you're working, while you're doing it. So that's a lot for a lot of people. But less than that is actually in the inactive box. And then from the environment perspective, category, toxins and air pollution, and hearing loss. So these were the 12 modifiable risk factors that were said to account for 41% of dementia cases. But beyond that, the other things that I counsel my patients on that are modifiable and can help prevent dementia in those who are worried, as well as those who already have dementia and want to try to slow progression. Sleep is a huge category, both quality and quantity, and I think sleep apnea is beyond underdiagnosed, and that's a very big one. Not only does it contribute to symptoms like acutely, right? People end up being chronically sleep deprived without even knowing it, because their brain is not getting restful sleep, even though they think they're sleeping all night. So the next day, of course, the person might be more groggy and not at their sharpest. So that's a short-term effect, but the long-term effect is actually terrible. It's a risk factor for not only dementia, but for stroke, heart disease, AFib, atrial fibrillation, kidney disease, and that's beyond preventable with the sleep study, and if you find that you have it, you treat it. So that's sleep quality, and then sleep quantity, really 7 hours a night is considered the minimum somebody should get. A few other factors that are important for evaluating for, and what's part of like the comprehensive evaluations that specialists like myself do, are looking for vitamin D deficiency, high cholesterol, polypharmacy. So trying to eliminate there's so many drugs that could mimic, cause symptoms that mimic dementia, or in those who have dementia can make things worse. And then diet is very big. So the most brain healthy diet is something called the MIND diet. I don't know if you've heard of that, but it's based on it's I don't remember the exact term for the acronym, but it's based on the Mediterranean diet and the DASH diet. DASH diet was developed for high blood pressure, and the Mediterranean diet. So it emphasizes, it's basically obvious foods that sound healthy, all right, and that are one ingredient foods. So it's green leafy vegetables, nuts, berries, olive oil, chicken, fish, beans are good, and then trying to eliminate processed foods, red meat, cheese, fried foods, butter. And so there were studies that showed that people who followed that diet, not even very strictly, even those who were kind of middle of the road, had less cognitive decline over time in terms of like people who are normal and then just being followed, and then also less development of Alzheimer's disease. And then from the physical activity perspective, just to take another comment on that, so the 150 minutes a week is what's recommended for moderate, and then if somebody's really doing vigorous activity, it would be 75 minutes a week. But beyond that, I'm sure we have a lot of patients who can't necessarily do such activity. Even just walking is helpful. There were other studies that showed just the number of steps you take can make a big difference. So 4,400 steps per day has actually been shown to have a mortality benefit in women. And then the more steps you take, the better. So I tell people, just start slowly, take a walk for 5 minutes if that's all you can tolerate, and try to build up, and have a step tracker, because then at least you can monitor progress. So any exercise is better than no exercise.
Thank you so much. I know I could ask another